stored emotional trauma and physical pain. The connection between stored emotional and energetic trauma is a direct correlation or in direct correlation to the presence of physical pain. Now, I share these stories because I have clients who have chronic physical pain that come to see me, but have a very heavy tie into past emotional, energetic traumas. And so when we talk about working with and intentionally focusing on the nervous system when it comes to SRT, it's because we understand how important that nervous system is in playing a role to communicate to your fascia, to your muscles, the response of pain. And so when we look at understanding how the emotional and the energetic storage of these traumas affect the very physiological body, the systems, your fascia, your muscles, that nervous system plays a huge, huge role into whether you're going to continue to hold on to and suffer from chronic pain or going to start shifting and releasing. Now, the release of emotional and energetic trauma comes in the form of tears, physical tears. We've heard and we understand that there are tears of joy, tears of happiness, tears of sadness, tears of depression and loneliness. And so when we have to release emotions and energy, a lot of the times it comes in the form of physical tears. And that is the body's mechanism or way of releasing emotional, trapped, energetic trauma. It has to come out. So what people do is they try to hold back their tears. And in doing so, you're trying to hold back that release of energetic and emotional trauma. If you were physically sick, if you had the stomach flu and you had to vomit or you had to throw up, it'd almost be the same as vomiting and holding it in your mouth and then trying to swallow it back down. It needs to come out. It wants to come out. It's trying its hardest to come out. So we don't want to swallow it back down. So we've been taught in society, especially males, to hold their emotions in check, to not show weakness, to not show sadness, to not show pain, to kind of push that back down and ignore it. And at some point, it wants to come out, and it will try on numerous occasions, depending on what the triggers look like, to come out. And so with SRT and with the clients that you see, you have to understand that there is a backstory to everybody. And most people's backstories involve mental, emotional, and physical abuse or trauma in some context. It doesn't necessarily mean that they were raped or molested. They might have been picked on, they might have been bullied, they might have been beaten by friends, family, colleagues, school, classmates, but there is a heavy, heavy connection to the energetic and the emotional piece as to where and why the physical has kind of come together. And so we share that, I share that because I want you guys to have a better understanding of what SRT is on the deeper levels and how physical touch and audio communication and discussion about the energetic and emotional pieces in conjunction with the physical techniques and the physical therapy that we do is helping to download and install new sensory input for their nervous system. Their peripheral nervous system is what's going to take that input, travel it up to the CNS or the central nervous system, and give them more data analysis and responses of whether this feels safe, whether I can let go, whether I have to protect myself or guard myself more. All of that is imperative in conjunction with discussing energetic and emotional traumas that might be stored within their system and needs to come out.